Joining us now here, we'll be moving on at this point to bring you up to date with the coronavirus outbreak. And to help us give some perspective on that is Dr. Olivia Fashola, a family health physician and researcher. She currently works at Pelon Memorial Hospital in Victoria Island, Lagos, as a consultant and health assessment manager. Her interests include, but are not limited to, public health and occupational health, travel medicine, and medical education. Welcome to the program, Dr. Fashola.
Thank you very much.
Thank you for joining us.
Thank you for having me.
We've been doing regular updates on the coronavirus, and we are so concerned that it keeps spiking. Every day you get very frightening reports. But let's start with something that was said by Professor Mojisola Adeyeye, the Director General of the Nigerian Drugs Administration Agency, yesterday. She said Nigeria has a crisis of drug insecurity. That 70% of the drugs that come to Nigeria are from India or China. And that is not a question of whether we will have coronavirus in Nigeria or not. It's a question of when. But our recommendation is that we should start praying. So what's the connection between what she defined as a problem, drug insecurity, and coronavirus? And do you agree with her that the solution is for us to start praying?
All right, so this is an interesting way to start. And as much as I believe in the power of prayers in everything and in every sphere of our lives, I must say that, how will I put it? The common saying is that heaven help those who help themselves. So before we start praying, we should actually focus on more objective and strategic ways to prevent the transmission of coronavirus. I agree with her. It's not a matter of if, it's just when do we get to know that the virus is here. As far as we know, there might be someone harboring it already. Yeah, but nobody has presented. The person could be sitting in his home, with symptoms, and we don't know. It hasn't been discovered in Nigeria. But we can't absolutely say it's not here. And now, regarding the scourge of fake medications and substandard drugs, it's a problem that has been existing for as long as, you can say, not even just related to the coronavirus, but every other problem. So if you look at the importation issues, getting substandard products from India, even China itself, which is a big supplier of a lot of products in Nigeria, you would understand that our importation culture predisposes us to, risks of importing substandard drugs and also importing viruses, just like the coronavirus. Yeah.
Oh dear. So now I want you to tell us what worked in the case of Kem Darrell, the 21-year-old Cameroonian student who contracted coronavirus in China and has been cured. He said, apparently he presented flu-like symptoms, tested positive, and then was on a course of antiretrovirals and antibiotics. What role did antibiotics play? Because it's a virus. And also the Chinese government now calling for blood plasma from recovered patients like himself. What role is that going to play?
All right, thank you for that. So basically, the management of viruses like the coronavirus and other flus is usually supportive. You can't definitively say that if you give this and this therapy, you're going to achieve cure. So it's usually supportive. That needs to be clear. So a lot of the treatment he got was supportive. And the role of antibiotics here was to help prevent and even treat superimposed bacterial infection. So with infection with this virus, your immunity tends to be suppressed and one is at risk of contacting other forms of infection. So even a bacterial infection could occur superimposed on the viral infection, and that would just make things worse. So that's the role antibiotics have to play in viral infections, but it's not necessarily treating the viral infection itself. And of course, the use of antiviral medications has also been found sometimes to be beneficial, though as of now the WHO hasn't categorically stated that as a standard treatment to be offered. But as we've seen in so many other forms of viral infections like the Ebola and even Lassa fever, sometimes antiviral medications are used to help suppress the virulence of the infection and prevent it from getting worse or severe.
And what about the blood donations from the recovered patients? What's that supposed to
okay, yeah, so that's still being researched, and the role is to derive, usually when one is infected with any form of pathogen, bacteria, virus, the body responds to it by producing antibodies if it's a bacteria, or giving some form of immune response. So that's what they hope to tap from, the response that those who have been infected were able to mount. So maybe some of the immunoglobulins that were developed by the originally infected people could now be used, of course, after so many processing and works in the lab, could now be used probably to help prevent or maybe to an extent reduce the severity of infection in those who might get infected. It's the same mechanism by which vaccines are developed. Yeah.
Okay. Now, you started off the conversation by saying that there's no doubt about the fact that coronavirus is already here, which is quite scary when you think about it. And looking at reports today, you could also see that Liu Ziming, who headed the head Wuchang hospital in Wuhan, is among the latest fatalities as well now. And it raises the concern about healthcare workers and practitioners in situations like this. Because if we're looking at a situation where there is no doubt that coronavirus, in quotes, is already here in Nigeria, how protected do you feel as a healthcare practitioner? We've spoken to several officials on this matter, private and public. On the public side, we're hearing responses such as the government is prepared and we do feel prepared. On the private side, there's a lot more anxiety. Why is this and how do you feel?
I'm a private practitioner, and as a family physician, I'm a frontline doctor. So patients get to see me and the likes of myself first before being moved on to a specialist if required. So yes, I must say it's with a lot of trepidation that you're there attending to patients. I had a patient cough in my face some days back, and in my mind I was like, okay, I really hope,
Oh my God.
I really hope, this is not something.
This is not from Wuhan.
Yeah, exactly.
Okay, now I really hope it wasn't something from Wuhan as well.
Yeah, no, not likely. The other risk factors were in there. So yes, we feel quite exposed in the private sector, and just like you rightly said, a lot of resources are being put in place in the public sector, but the same can't be said for the private sector. And what the government tends to forget is that there are a lot of private hospitals. People are likely to walk into a private hospital first before walking into a government hospital for several reasons we won't discuss now. So I really think that as much as is being done in the government sector should be extended to the private sector. And I'm also not a proponent for depending on the government for everything. I think we're all stakeholders in this, and even the private sector should begin to take proactive steps in protecting themselves. So some of the resources that are required could be sought from non-governmental organizations. It doesn't have to be the government. And apart from that, we could also put in some basic precautions that you are expected to carry out as a private, as a physician, as a doctor, are things that can actually help prevent and protect us. So universal health precautions, every doctor knows that those are things you should adhere to, hand washing. Usually the mask should be for the person who is spreading the virus. So a patient walks in, like the one I said, should have a mask put on as long as he's coughing or sneezing or has flu-like symptoms, right? So those are little things that could go a long way to help protect us while we seek for necessary support from wherever it may come from. So, but as much as possible, this is an avenue to call on to the government to realize the important role that the private sector plays in healthcare in Nigeria, and also the role that we play as frontline doctors in preventing the spread of this. I mean, one of the situations that was a very clear, that highlighted the role of, was the case of the Ebola. It was a private hospital the victim walked into, and it was in a private hospital that it was contained. I am I don't know. I fear that if he had walked into a government hospital, we might not be saying the same story today, because it's easier to an extent to contain things within the private hospital setting because they're usually smaller most times. And apart from that, they might also be able to enforce certain rules and precautions within the private sector or within the private hospital. So it will really be unfortunate if the government is not yet looking at the role that the private sector has to play if we're going to learn anything from the Ebola virus outbreak that we had.
I mean, you have a very good point here. You know, we had on this program once Dr. Sylvia Cole, and she made exactly the same point, that it's important for the government, while looking at the public sector, to also see how private sector, you know, medical practitioners can also be assisted and can be prepared in the case of any emergency with regard to the coronavirus. But let's talk about the WHO. Dr. Ghebreyesus, the Director General of the World Health Organization, visited China January 28th, and he came out of that and said, well, you know, nobody should isolate China, and give China a pass mark in terms of efforts at prevention and containment. But the kind of reports we've been getting from China, you know, looks like, you know, this threat probably needs to be moved from a health emergency of international concern to a global pandemic. What do you think? Do you think the WHO is understating the threat that the entire world faces?
All right. I don't think the WHO is understating the fact. It's a personal opinion anyway. And the reason for this is that, sincerely, China must be applauded for how well they have been able to handle this. It's really not easy, and we've seen them put in a lot of resources within a short span of time to curtail this. And yes, as of now, over about 25 countries have been affected or have a case of the virus. However, the scare that the public has, right, stems from looking at actual numbers. So you hear over 70,000 cases have been confirmed. There are almost about 1,700 deaths, and you know, you get scared. But when looking at it from a global perspective, right, you will get to understand that compared to other viruses, other outbreaks that we've had in the past, like the SARS and the MERS outbreak, the coronavirus does not seem to be as fatal. It might be killing.
Or 2.8%.
Well, thank you very much, Dr. Fashola.
Thank you.
Bring it to a close at this point. Thank you very much.
Thank you.